Hello, everyone. To you all to today's session. Zooming in on human rights in East and Southern Africa. I am JD Ramalapa, Editor-in-Chief of Sound Africa, a nonprofit podcasting organization with a mission to produce stories that advance social justice of everyday people. I am coming to you from Johannesburg, South Africa, and I will be facilitating this webinar, which is Human Rights, Mobilizing Media in the Fight Against COVID-19, or MMFC project, in partnership with the Journalist Network of Uganda, the Media Owners Association of Tanzania, and Sound Africa. JHR, Journalists for Human Rights, is Canada's largest international media development agency, conflict-prone areas across the world. Since 2002, Journalists for Human Rights has worked outlets, civil society organizations, and other relevant stakeholders to strengthen and improve human rights. Journalists for Human Rights also works to create an enabling environment where objective media can flourish. Heard. Our panelists today will also illuminate on some of their experiences reporting how to produce rights media stories from their respective country perspectives. But before we dive into the main, that we will be taking questions from the floor after each of our panelists have made their presentations, which will. If you are a note taker, please take down your questions and pop them into the chat box as we. Due to scheduling conflicts, one of our panelists from Tanzania, Semi Awami, is unable to join. However, we are very fortunate to have here with us a panel of brilliant journalists and passionate media who have been on the coalface, the front lines, if you will, of reporting and monitoring the reporting. Without further ado, from Kampala, Uganda, we have Esther Nakazi. Esther is a health and the founder of the Health Journalists Network in Uganda. Esther trains and mentors journalists in science, various media outlets around the globe. She is a graduate of Makerere University and has a postgraduate. She has won a Knight Science Journalism Fellowship to spend the years 2007 and 8 at. She also spent time as a journalist in residence at the Institute of Tropical Medicine. She is a Media Freedom Fellowship Fellow. From Johannesburg, South Africa, we are joined by the Program Manager for Advocacy, Litigation, and Lobbying at Media Monitoring Africa. Azola has worked as and marketing officer at established organizations and publications in the Gauteng and Eastern Cape. News and media junkie, Azola also enjoys conversations around literature, philosophy, politics, journalism landscape in South Africa. Our first speaker today is going to be Esther Nakazi. In addition to giving us a summary of the impact of COVID-19 on human rights in Uganda, Esther will also reporting skills for journalists in Uganda and Africa more generally. Esther, the floor is yours.
Thank you, everyone. I hope you can hear me. My name is Esther Nakazi, as I've been introduced by Jedi, and I'm glad to be here to and what is going on right now. Right now in Uganda, what is going on is the second lockdown that the country is having. We are currently experiencing a second wave, and for all the media, it is an exciting time for us to write about human rights, to write about health rights, to write, because it's something that these two are tied together at this moment in time, especially during. I'll divide my talk into two. One, I'll talk about the impact of COVID-19 on human rights in Uganda. And then on a bigger scale, I'll talk about focus on the level of health and science reporting in Africa, because I'm also a trainer, and I follow a little bit of what is going on. So like I said, right now in a lockdown, we have the second wave. Cases are rising every day, and the level of rights abuse is really high. And it's high not only for a certain section of people, but across the board. So we have a duty as the media right now to share information, share correct information. We have to share correct information. Let me emphasize that, because during isolation, there is a lot of mental health issues going around with everybody. So deep down, people are anxious. So it is our right, it is our duty as journalists right now to it is our duty as journalists to give the public information at this point in time, because as variants are coming in, as the governments are coming up with different, new, and it's our duty to keep them updated on what's going on. So there are so many happening right now, and what I would like to highlight mostly is the fact that with the COVID-19 pandemic on hand, we journalists have to first of all look at our rights. As you know, don't have incomes, and it's not only other sectors, it's our sector too. Some have cut off staff, some have not. So it is our duty to first of all talk about these things as the media, as we fight for the rights of others. But we also have a right to fight, especially for the health. Now, as the cases surge, like I said, it's a matter of survival. People are dying. The prices to hospital here in Uganda is just exorbitant. People can't pay. The money is too much. And to also help the health workers, whose some of them, their rights are being violated. They don't have the to work, they swore upon these oaths, and they are supposed to deliver services, and it's a big problem. Supposed to be overlooking everything that is going on, provide information, but some of us also don't have PPEs to go and be protected as journalists, because freelancers, you're not anybody's responsibility. You're not getting allowances. You're on your own. So the story health rights, human rights, and what is going on in the country. And the governments are also coming up with the public, but some are also harmful because they are trampling on people's rights. We have consistently seen that women, especially women, violated more than any other group, and children are also having their rights trampled on. Right now, children are not. They were super spreaders, and even if they had opened at first, now they have closed again, children at home. Some of selling stuff on the street, and they are below age, they should be at home, their rights are being trampled on. But they have to be brought out to the public, so that maybe a mother does not understand that this child has a right. Maybe they are not in school, they are not supposed to be working somewhere hawking sweets and doing all that sort of thing. So what's going on, the pandemic is happening, they're seated at home, there is no revenue, they may feel like they are contributing to the family. So the way we present these stories should really show what is going on, support and show our leaders that these rights have to be protected, especially during the pandemic. We also have a lot of sexual rights, sexual reproductive health rights that are being trampled on. Center spread of everything. People don't want to go to hospital. Here, you cannot have a permit from one of the authorities, and getting a permit is also a problem, even to some of us, the media. If you're a freelance, and that is, you have a right. I mean, you're supposed to go get information, but getting a permit is also a problem. And then there are people who access health services, they cannot, because there is a directive that has come on, curfews are on, and then all these rights that are being violated, and we have to write about and for the promotion of our societies and access to some of these things. So healthcare, many teenage pregnancies coming up because children are redundant, they're seated at home. We have seen people who cannot care because they can't access transport, they cannot, everything is distorted right now. Are being told of torture, because if the curfew is at 7 and then somebody is running around and they are not on them, then they come up. That's a human rights story. So we have directives by the government. Good, some of them are good or necessary. They may not necessarily be good, but they are necessary for the protection. Also have human rights on the other side that plays out, especially during this lockdown. And like I said, gender, we have to look at these issues as you cover human rights stories. We have to look at gender perspective in terms of talking about human rights as we cover the stories. So I'll transition side story of my talk, and I'll make this really brief. The focus on the level reporting generally. So at first, when the pandemic had just started, we have handled pandemics in Africa. We have written about pandemics. We all know that. We are all health reporters. But then was in the newsroom became a health reporter. And I know that COVID-19 is cutting across every other you know, it's politics, it's health, it's everything. But then we had the health, but we did not have enough information, just like the scientists, just like everybody. The virus was new. We had a media cafe and we invited a professor who is very good here, Professor Kalebu, and we invited an epidemiologist who is also the advisor to the president on epidemics, and they didn't know someone. So the reporting at first, pretty much everywhere, not only in Africa, but I guess everywhere, because nobody knew about. Yeah, we knew how to cover pandemics. We have gone through HIV, we have gone through outbreaks of cholera, we know how to cover those. Something new, a virus that had hit China, it was spreading, the scientists were still investigating, and then we have progressively come covering it, and people are catching up along the way. And thank God we have, I think, have had an opportunity to attend and also to train. And there are so many efforts on what's going on. But I think right now, in terms of Africa, the story of our time right now is vaccine. We in Africa do not have vaccines. We are relying on the Western world. To me, that's a health right issue, or we have to drum it up and tell these people we need. The virus is mutating. We are getting variants every day. We now have like of the variants in Africa. The Delta variant is dominant. It's spreading super fast. To have people vaccinated. And the only way we can do this is to have our voices in the communities and the voices of our people in our countries heard for a need for vaccines. I don't know. Already we have, you know, the EU green pass that is discriminatory against the vaccine. Serum Institute, you cannot travel to certain places because of, so there are so many factors at play with rights, and there are so many factors at play which are making us not get, we don't have. Well, South Africa is trying to do that, but how soon will they be able to produce the vaccines so that we are able to access them? To buy from the COVAX facility, even if they did have the money, the vaccines are not there. The Serum Institute that was supposed to, all these issues that are cross-cutting against us in terms of even when the vaccines come, people who are being targeted are few. So we are living in the times of rights, and we, the media, have a duty right now more than ever to drum it up, to show the world that, especially us in Africa, need the vaccines, and we need them to hear us. Those who are holding, they want to keep them, they should be fair. I mean, equity is about fairness, and it will. If one world is vaccinated and another world is not vaccinated, we will all suffer. The variants will multiply. Drama going on. So can I keep going? I'm sorry. So as I conclude, I just want to say that have tried our level best. There have been so many challenges during the pandemic in terms of rights, rights of information, rights on how to get this information, and how, I mean, if to even accurately report on what's going on. And for those who have put in efforts to, there's still a need to train more journalists around the continent to be on top of the game in terms of reporting on this, out on what's going on, so that we drum it out. If the EU is saying that the AstraZeneca that was given to income countries is not valid for them if we are going to travel, we need to drum it up. I mean, it got a EU elf. The European Union is saying they're not going to recognize it. It is us, the journalists, to fight for our rights, to fight for everybody, that our rights to travel are also listened to. And it is also our right, it is also our duty as journalists, since our people need vaccines, and they should get vaccines from countries that are holding them, and report about it.
Thank you so much, Esther, for an informative presentation. For those of you who've just joined us, please remember that we will have a Q&A session after each panelist has made their presentation. So if you have questions, please jot them. Time comes. Our next presentation now, we coming back from Uganda down to South Africa, where the country is the deadly Delta variant, particularly in the Gauteng province. The country is now on lockdown level 4, which association and consumption of alcoholic beverages for the next 14 days. In addition to a brief human rights in South Africa, our presenter, Azola Taile, will also focus on corruption and disinformation, which obstacles and challenges to managing the spread of the pandemic in the country. Azola,
thank you very much, JD, and thank you to Esther as well. Very brilliant presentation with a better understanding of what is. So I've got this big responsibility to speak on very big things, disinformation and go on to sort of undermine human rights in South Africa and vis-a-vis democracy. So I will just give a brief disinformation in South Africa, and then perhaps go into a little bit information of how these then do really undermine. So, corruption in South Africa is a very big and old issue, which precedes the COVID-19. Obviously, is still lives on today with the pandemic. But I want to start on a point that Esther raised on the Americas who are holding vaccines, and for me, I think that's a very best and beautiful place to start when. There is corruption at an international level, where countries with little numbers than African countries, where they 99% of their populations, but still have vaccines on hand, but are not willing to share with African countries. I mean, we're seeing tournament. Europe is functioning very well, but in South Africa, for instance, we are on lockdown level of 4. Being shut and many other amenities, and people are losing jobs. But then you have Europe, where citizens are enjoying, so and those kind of things. So for me, I think that is the biggest corruption internationally, before we come to the context of Africa. Also, it's not different. Corruption is, as I've said, as old as our democracy. Cases where our political leaders are taken to court for, things that they've done long ago. But in any case, with COVID-19 and corruption in South Africa, we've seen, a misappropriation of funds, where money is put gear have been ended up on pockets of political leaders and those who are. And to give an example of this is the health minister himself. It's a bad example to give because this is the person of the COVID-19 response at the helm of protecting the citizens of South Africa. He is the health minister, but he has been recently found for COVID relief, meaning that, in terms of COVID vaccine rollouts, there is a number of batches that we have received, but they are on hand. They can't be where they need to go, precisely because the people who are in charge of supply chain or who make decisions at the upper echelon the funds to their own personal projects. So as I've said, the minister has currently been irregular tenders relating to the COVID-19 PPE tenders. Information. I'll come back again to corruption. I just want to give an overview of both disinformation and corruption as an issue. But that it's not an issue, unique to South Africa. It's a global issue, and South Africa, with the advent of COVID-19 at the beginning of the lockdown. It's also very Africa, at least the organization I work for, we differentiate between disinformation and misinformation, with misinformation being was not sent out with the intent to cause harm or malice, but then with disinformation, it is of information for particular ends. They could be political, they could be economic, they could be otherwise. And we've seen a rise in campaigns to undermine efforts against COVID-19. And we've seen this also from, but this has also come about from, political leaders in the political landscape of South Africa. And SA, for instance, Herman Mashaba, who is one of the leading proponents of the biggest disinformation, I will say, which is the hashtag Put South Africa First. This hashtag also has xenophobic connotations to it, which then turning into hate speech and vis-a-vis obviously undermining the rights of asylum seekers and this is the former mayor of the economic hub of South Africa in Africa, which is Johannesburg, and he peddles this on a day of transport. Fikile Mbalula, who not so long ago unfortunately fell into the trap of tweeting a lot, and people can and do actually die from vaccines. I mean, the government is on a big communication vaccinated in the midst of disinformation campaigns saying that vaccines are bad for people, vaccines kill people. People are turning into I don't know what. And this, a minister, a custodian also of government communication, goes out on social media and tweets that people do in fact die from vaccines. So that is also another big instance of South Africa at a mainstream level. So in terms of I want to bring this back to JHR's MMFC 19 journalist mentorship. South African journalists, at least in South Africa, we're mentoring South African journalists on producing stories related to COVID-19. Unfortunately, did not see stories that explicitly touch on this matter, and the reason for this is because the people, the journalists who are, rightfully so preoccupied with matters that are rather local than, national. very good stories focusing on the local political landscape, which touch on COVID-19 and human rights. And in Gariga, formerly known as Utinek, his name is Tamsa Mbovane, sorry, and the story is about how a family has been left without any food in their house now due to the program being discontinued. So in South Africa, the government they called COVID relief grants, an amount of between 300 to 400 rands a month to people who are unemployed. They cut that thing out. So this family who was heavily reliant on that, they are unemployed, child-headed household, but now they have had this relief fund cut. And part of the reasons that this relief fund has been cut is because leaders were misappropriating funds. There were a lot of monies that came in. There was a 500 billion rand that has not actually been accounted for today in relation to COVID. So we had that story, but as I've said, it was a local story focusing on the small context of Utinek, where this particular hang drying out because COVID relief grants have been cut. There's also a story I saw of the basic necessity of running water, and all these go back to the issue are allocated for these people to actually, deliver these particular services. But as I've said, they misappropriate own personal endeavors. And unfortunately, this really undermines the efforts in South Africa, as I've highlighted. First and foremostly, there's a huge backlog in terms of where we have vaccines on hand, but they are not being rolled out to the people that need them in the many places of South Africa. In terms of closing schools and opening schools, which is causing panic and confusion. Currently, they are being told to close on Friday, to have been closed, but just opened also recently. So it also sort of tramples on their rights to quality education. So yes, also on the part of disinformation, yes, to go back to disinformation, there is also a new related to the campaign I mentioned earlier, Put South Africa First, and now it goes by a new name. It was Operation, unfortunately, start online, but have consequences that are offline, and severe consequences, where even two instances where people operation to do light happening in the Southwestern Townships of Johannesburg. And what was happening here, the community had good corruption and crime in the community, so rapists, people who rob people at night, but it ended up now having a where the focus was foreign nationals without any proof of them being involved in criminal activity, and to just root out foreign nationals from the townships in Johannesburg. So it's another primary consequences offline. We did not have, I repeat again, we did not necessarily have stories that disinformation is an issue, but we did have stories that at the local level speak onto corruption and how it undermines democratic process. So I won't want to be long. I'll stop there. If I wasn't clear or whatever, then people. Thank you, JD.
Thank you so much, Azwela. I'm sure that people will have a lot of questions for you. Fortunately, next up now, we're going to have Sami Awami joining us from Tanzania. Freelance journalist, a media trainer and mentor with close to 15 years experience working in the Tanzania. The BBC's World Service bilingual correspondent in Tanzania, a position he held for 5 years. with a master's in public policy at the University College London, as well as reporting news. Sam advises on advocacy strategy for policy change. Sami's presentation today will focus on how pandemic risk. Sami, the floor is yours.
Thank you for having me, and my apologies for joining late. There's a bit of a clash. Happy to finally being able to speak to you. My connection is very bad, so switch off my camera so that at least we have a clear conversation. I'm just from another meeting, and the video. So if you don't mind, I would switch off my video, please. So I'm sure most, if not all of you, have been following events in Tanzania since the situation here was really bad. I mean, it was just as bad as you're reading from different media reports. And one of the reason why things were particularly terrible here in Tanzania is that sadly, who sort of led this really terrible approach or policy when it comes to or in handling the COVID-19. In the beginning, I should stress that Tanzania took a very we shut down our schools and all big gatherings immediately after the first case was confirmed. Advised to take precautions and really encouraged, to avoid big crowds and things like that. Perhaps you've seen meeting visitors at the State House, using legs and things like that. So in the beginning, maybe things were quite all right. We were moving as we should, just like the rest of the world, really. After that, things just became bad and bad and bad going forward. And on that, people not taking actions, but you had head of state, the president, basically, undermining or kind of telling people that, talking more about it or talking more about the risk, putting fear to people. And so people should stop talking about that. And with that, sort of even came some to the media for media covering about these events, basically, because it was said of top government officials, including ministers of health and other politicians, were sort of telling that talking about this consistently is just instilling fear in people, and that people should go out, continue. Whereas apparently the officials were telling people that it was not as bad or as scary or as deadly as the people would. And so anyone who was sort of encouraging people to take precautions, was because apparently this is the thing that the West just wants to undermine the country's efforts in reviving the economy. Bad. You had the president firing the chief medical officer or an expert at National Laboratory because apparently they with the West to announce false numbers of people who are contracting the virus in the country, and so on and so forth. So bad, and mainly because of the president basically leading people in a very unscientific way worry. At some point, we announced that Corona has completely been defeated in Tanzania because we prayed and God, and he got us rid of the virus. And with that, came such a, especially in people's perceptions about the virus, because while initially we had precaution wearing masks, immediately after the president started telling people it's okay and everything is fine, people stopped doing all of that. Everything went, you realize that people's rights were basically deprived, or were people were not hearing then reports from the media, so their rights to information was basically crushed. People could hospital, they were told you're not having COVID, you're not suffering from COVID-19, but difficulties in breathing. So their right to health was even stopped going to medical to hospitals, medical centers, because they know if they went there, they won't be told what, because the government decided that we did not have that problem in Tanzania. And so that is briefly, I think that's briefly how things were going on in Tanzania. And even now, even though as the president, the new president is sort of trying to way, that damage which was done by the past administration has still remained. People are still very reluctant to take any whether to go back to reporting properly like how it should be, because journalists are members of community. COVID is not as big of a threat by the president or even some quote unquote scientists from the government. Laissez-faire or lean, or like ignoring the danger of the COVID. And so consequently, even the reports really of what exactly is happening on the ground. But thankfully, the new government seems to be, we are seeing, people going to the hospital being told that they have COVID or they don't, and the media is slowly. I'd like to stop here, and then I'm happy to take any questions if they're available. Thank you.
Yes, thank you so much, Sammy, for your very informative presentation. If there's anyone who has data from South Africa, Esther Nagazi in Uganda, please feel free to put in your questions in the chat, answer them directly. I'm just very curious to hear how difficult has it been for you encourage journalists to go out there and cover stories. We know that for the past 3 months, through the Journalists for Human Rights, to train journalists on how to focus on human rights. So can you just maybe give us more information on of how the COVID is impacting human rights in Tanzania, especially as you were just elaborating on the virus in general?
So generally, I would say, it has been quite difficult. Like I said, journalists are part of a community initiative, and if they're not getting the right information, or even scientists, their understanding as well is also affected. That we were able to do with JHR, it was really interesting to have that opportunity to speak with the journalists, to hear their understanding, just about the COVID, but also just in terms of how rights are being trampled on when you have a situation like. And from what I heard from the journalists that I was training in Zanzibar, is that their eyes were quite opened. That what they knew, they understood, yes, that there's a problem in Tanzania in the way that we're handling didn't know much was the connection between the way the government handled coronavirus and how the rights were being trampled on. So it was really an eye-opener for most of them to really talk about why, for instance, to right to information, was when journalists are forbidden to report about these issues. Last year, an online media being shut down just because they reported an alert from the US of COVID. And so when media organizations are punished in that way, they stop reporting right information, or stop. It was difficult, I must say, to many journalists, first of all, to get the right information. And if they don't have the right information, then the public is also deprived. And so thankfully for the training like what we had, we've had journalists from quite a lot of issues. They reported, for instance, in Zanzibar, how over 10,000, or no, not 10,000, over 1,000 primary school students did not go back to schools since the schools were shut down. How business people lost their businesses, small traders and factories. So since that training, reporters who thankfully were coming from some of the big and major media organizations in Tanzania, reporting on this right and human rights. So yes, definitely this kind of training are quite useful.
There's a follow-up question for you there, Sammy. Musa Juma from whether it's possible to have such training on the pandemic in Tanzania, and if there is any support in terms of for journalists in your country.
That is a good question. I'm not sure why, Jenny. I see Madiba is on this call, so he's probably at the right place to do that, to respond to it. But I'm available. I'm happy to share my contact, and thank you, Madiba, for responding to that question. I'm happy to arrange with you and share the material with you about what, for instance, we discussed with other on the mainland. But if you are asking about an organized kind of training, then to get back to you later after I've had maybe a chat with Madiba and other trainers here in Tanzania. So yes, I'm happy to provide that, but I think we'll have to arrange for that properly.
Nzako Shivambu wants to know whether countries like Uganda and Tanzania charge citizens when they seek help facilities, and so what is the impact of citizens having to pay for access to health when they are in a pandemic? Esther?
Thank you very much. Thank you, Sam. That was very insightful. It really gives me a lot of pleasure to listen to what is happening elsewhere, because if we are really to report about Africa and, make an impact, we need to compare those, and so it was just enlightening to hear from both of you about what's happening in the respective countries.
We have lost Esther.
You can't hear me?
Sorry, Esther. Yes, you were frozen for a while, but we can see you now.
Public health facilities in Uganda are not supposed to charge any monies for I think of user fees that can be paid, but it's not like they're supposed to. But during the pandemic, health really being trampled on, even in government facilities. First of all, hospitals here in Uganda. Go to a hospital, we journalists are covering stories where people are saying, you know, I took my patient to the hospital, that they remove somebody from oxygen and then put my patient. That's morally wrong. Even however much you want to say you love the person you've taken to hospital, but you're costing another person life and you're going to die. And then I liked Azola's issue of corruption. The level of corruption, because we know that here in Uganda, money was received. We got funding for COVID-19. You know, tenders went to certain people who are supposed to build up oxygen. So there are all these stories that are catching on health rights and human rights, but back to your questions, public facilities are not supposed to ask people for money, but they do. Are being held. If you do not pay a certain fee, your body will not, if somebody dies of COVID-19, pay, they will hold your body. I mean, that's unthinkable, but it's happening. I just can't explain some of these things, because you read in the media the level of violence on this call, who are part of the project, saying we are not really seeing there's human rights abuse everywhere now. The level of corruption, Azola talked about relief to be given here in Uganda. That's a story that can be followed up, and I think it is something that people should really getting the money. How are they getting it? How all those things have to be brought out, but most they have to account for whatever is happening. Why is there no oxygen? Why are public offer people free treatment, charging them all of a sudden? And why do we wake up in BCD, you have to, there are no vaccines. I mean, if the first world countries went and booked in the COVAX facility, to which nobody anticipated would happen, but still we as journalists need to drum this. Our communities, our people need vaccines. We need vaccines. We do not want the variants to mutate so Earth, and it's only vaccines that can save us. And we do not want to pay exorbitant fees for public our lives. So it's happening here, and it's bad, it's terrible. And I think all of us have.
You're welcome. Azola, can you please answer the question again, whether people in South Africa are paying for
Yes, private citizens, I do believe that they have to pay for, testing and getting rollout program for special categories. So this is basically mainly for frontline public sector workers, which include, there are almost close to 1 million teachers this past week who are being vaccinated nationally. They first began hospitals, nurses, doctors, the porters, everyone. And then I also think that there's a special category for senior citizens. So I think people who are sick get vaccinated free of charge. But then everyone else, for now, it's do understand that the government is lobbying, the public, the private sector rather, and civil society to also roll out programs to mitigate the numbers.
Yeah. At least she says in Germany, journalists are considered emergency workers and they were given priority vaccinations to go about their Uganda, Tanzania, South Africa. And a question to you specifically, Esther, can journalists in around to and report despite the lockdowns?
Okay, I'll also start on these questions.
Yeah, sure.
Add on to what I just said right now. I do understand that there are efforts to by civil society, my own organization, where we are saying that journalists should also be considered as frontline workers and should be receiving to actually being where Germany is in terms of vaccinating media practitioners in South Africa.
So much, Azola. I'm also aware that we are actually running out of time. So if everyone is agreed, we'll add another 10 minutes for our panel. Some of your questions, which are a lot. So I will just go over to you, Esther, and to answer this question of journalists in Uganda are able to move around, and if journalists are receiving priority to go out and report.
Okay, so what's happening in Uganda is journalists frontline was, and they could access vaccines, but I'm not the first time, a lot of hesitancy, but definitely they were considered as frontline workers and they were in that category. Now, during lockdown, what is going on is you have to get a pass. We are lists and get a pass from the government to go around and do your duties. However, there are very few journalists who can I mean, I am a freelance and getting this pass may not be easy as some and their editor or their manager will just send the names of these are the people who are working on my news desk and I need maneuvering freelancers and the majority of us are freelancers is a problem. So you have because freelancers and they cannot get passes and they cannot do their work very well because the passes are necessary and the passes are in terms of PPEs and insurance, you're on your own. Like I said, you have to provide the PPEs for yourself. You have, if I have to move and I'm using a private car, I have to use my fuel. I have to buy my sanitizer if I have to go to interview somebody. That's a health risk. So there are all these issues that are playing up, especially for freelance staff writers. Media house will not provide them. It's not as easy as a cup of tea. So it's a difficult. But the vaccines are free and journalists are considered as front.
Thank you, Esther. Semi, it's your turn to follow, and I would really like you to answer some other questions that were, whether you have any data at all, like really a picture of what is going on in Tanzania in terms of and vaccination. And also there's someone else who wanted to know that Tanzania is well known for having good producing herbal medicine to cure COVID-19, just like it's happening in Uganda.
Start with Vivian's question with regards to the situation in Tanzania. Unfortunately, it is exactly the situation in Tanzania, because we don't have numbers. 2 days ago, was it yesterday or 2 days ago, the president 100 days in office. For the first time, she said there were a little over 100 patients in of them, were on ventilators or were needed special attention. The government officially actually said numbers. How many patients do we have in Tanzania in hospitals, and that was. And so we do not know. But then these numbers, when she says they're about over 100, how the situation has been in Tanzania, no official policy for masks, except for government officials to just you consider that we haven't had any lockdown, business has been going on as usual. It's difficult to believe that only in hospitals or who are suffering from COVID. And so the short answer is that we are still operating numbers, but also these numbers that the president has said are quite now, considering how we're operating. You are in a lockdown? No, we've never had any lockdown, and it doesn't seem like the current government is interested in have changed the administration, but we still have the same party, CCM, which was quite popular last time when of lockdown. And so there's no way this president can introduce now lockdown and say we're going to lockdown and force everything. People to continue wearing masks. For instance, in all her public meetings now, you'll see majority of attendance. Some of them are not wearing masks properly, but at least you can see they're having them either on their hands or they are just covering their mouths, and it's just business as usual. Are journalists considered workers? Was that the question? No, journalists do not have any special treatment with regards to this, because organized like official policy in Tanzania when it comes to COVID. So journalists in Tanzania today, you think that the world is in fighting pandemic. For journalists, when are we going to order whether we're going to have journalists are going to have vaccines priority list? That I don't think so, because we are not even sure when are we going to get this vaccine. Filled some initial forms and applied to get vaccines, but it's not clear when are we going to get this vaccine to get that. But I must say, as part of this, a significant damage done by last president, reluctant to take vaccines. I heard, for instance, from one embassy here that which was 100 Tanzanian workers there refused to take the vaccines, even though the vaccines was available there. And so, then the situation generally in the country, how uninterested really the public is, or uneasy it is, because the former president is safe. So a lot of people are not are cautious, very cautious, and are not interested in vaccines. Is there any other question I've forgotten?
Yes, there was one more about herbal medicine, which I'm most happened yesterday. Where is that? Are you producing more?
Herbal medicine. The Ministry of Health, there's a special department for herbal medicine research, approvals, and all of that. So yeah, medicine, and this is what was propagated even in the last administration. I was telling JD yesterday that There is a massive container-like installation there for people to pass by there. You pay about inhalation, and apparently it's believed that it helps you, it protects you from. Past administration, there was a lot of campaign to encourage people to use herbal medicine. I'm sure you've seen report or even videos of brewing some vegetables, making vegetable smoothies, and saying it cures. It propagated in the last administration, but slowly now we are seeing less of that, and so there are a lot of ginger and other vegetables that can help you, with COVID and stuff like that. But I as an official policy or an official advice by this new government as it was in the past, but still just to see if they can get help from COVID, against COVID.
Sammy, Azola, there's a question for you from Kalungi, and he wants to know whether what South Africa help vulnerable groups or people who have been affected by the pandemic who cannot afford food during this period. Would you like to take?
All right, thank you, Jedi. So if you are an indigent person prior to COVID, I would assume sort of grant, given that you're over 60, or you are an orphan, or you are under the age of 18, or you or you are differently abled. So the government has a social development department where poor part of the working class via social grants. But then with COVID, they introduced what this was special in the sense that it was for people who then have lost the jobs through COVID or the pandemic, who previously the state grants. So yeah, with COVID, if a person lost a job during COVID and they were who according to the story at least, were dependent on the COVID relief, their jobs during this period, and their incomes now, these 350 that they, so that is the kind of support that is there during COVID. But as I've said, it is also inconsistent in the sense that now that we've gone a level higher again and we've closed most businesses, people are lobbying for the government to again bring back that group, lobbying for it to be a universal basic income grant for those who are unemployed, regardless of is what the government is doing. I hope I've answered.
Thank you very much, Azola. Yes, you have answered some of the questions. We are wants to know whether there is a fund for journalists in Tanzania to learn how to cover the pandemic. Prince Kintu is commenting on the fact of security in Uganda and how they are manning roadblocks. And I'm just going to give you all the panelists just a few last minutes, 1 minute each to sort of conclude before we gone over time. So I will start with Esther. Maybe you can comment on the security situation and journalists from doing their work, and followed by Azola and Sammy with your final comments before we close.
Very much, Jedi, and thank you very much everybody for attending this. Thank you for taking time off. I know everybody's busy. The security situation is terrible. A number of journalists here have reported about it. And I think it is against us. It is for us journalists to just make the leadership understand that even if they have put in place a curfew, the security personnel, they have no reason to trample over us and beat us because we have violated one of the, in place. I also have to say conclusively that we have had job, and especially the ones we trained on human rights and health. There is a little bit of a problem for some of them who actually can write the stories, but they do not link. Right. I mean, if people are going to the hospitals and they cannot access services related. So I think by and large, we need to really think about the rights issue deeply as we cover the front of us during the pandemic. But I also like the fact that all these stories are playing out in other areas. In South Africa, we've heard from Azola. So these are happening, and it gives the richer story when you read what is happening elsewhere, because that's a good thing, really. So thank you very much for listening. Over to you, Jedi.
Thank you, Esther.
All right, thank you, JD. I think someone has their mic on, unfortunately. Does someone have their mic on? Can I speak now? Okay, sorry. Thank you, JD. So for my closing remarks, I just want to also like Esther as their time, their ears, and their eyes joining this session. Thank you to fellow panelists. They're quite insightful in our neighboring countries in Africa. And I also want to encourage the journalists that were with us in this, find these stories and pay deeper attention, listen, and have one up on the always people of mainstream media. Yeah, because they're always the ones who are given the spotlight and the big stories, but I think the most important and work that has actually impact on people's lives are the grassroots journalists at the community. They find these human rights stories and bring them to light. Thank you, JD.
It's your turn.
Yes, thank you very much for everyone for attending. And thank you to my, it's been quite insightful, a few minutes that I joined. Here in Tanzania, it is taking more of a scientific approach, or at least that's what it's trying to do. So there's a little bit freedom for the media to report without fearing or much of government. That in the next few months, and in the next maybe few years, things will remain like they are right now. Things, and maybe that's when we can increasingly start seeing these stories being reported on the media, not just about COVID. Our people's, individuals' rights are being trampled on, either via through COVID or via COVID government policies in one way or another with regards to COVID. So yeah, thank you everyone, and it was good being.
Thank you so much, Sammy, and to all our panelists for joining. Just before minute left to welcome the Regional Director for the Journalists for Human Rights project in Mandela with us, who's going to maybe answer some of your questions about whether or not the program will be extended in Tanzania and future plans. Mr. Madiba, the floor is yours.
Thank you very much, Jed. You're wonderful and informative presentation by our panelists, and we really appreciate to those who have attended for joining us. And of course, there are many questions that have been raised. I'll try by all means to respond to some of those questions. One, and then of course, with consultation with our implementing partners, that is HECHNU in Uganda, Owners Association of Tanzania in Uganda, and that is Sound Africa and Media Monitoring Africa. We will be to provide more information after that consultation on the possibilities of extending. I can guarantee we are working towards extending the project further a little bit. So therefore, I am kindly requesting all the journalists to be in contact with the media trainers in all these countries. Please, J.J. Ramalapa and Azola Daile, if you are interested in joining the program and in contact Semi and Gasarigwa, and also in Uganda, you can contact Esther. In joining the program, we'll do our best in consultation with our partners to try by all means to extend the program and to do a further training of journalists there. And I think in all the countries in East and South Africa and Uganda, we are more than prepared as journalists for human rights to exchange, to further extend with our implementing partners. Will be able to formally communicate to everyone who are interested in fight COVID-19, particularly as we are now currently engaged in the vaccination process, and we all vaccinate 1% of the population in African continent, which is a crisis on its own. And we'll do our best in mobilizing our resources and our strength in making sure that we are waging in the best way we know how from a journalism point of view in the African continent. And thank you everyone for looking forward to the next program.
Thank you. And to our expert panelists for such a brilliant and lively discussion. We wish we had more time. And rights in East and Southern Africa from Uganda, Esther Nakani, thank you. Semi Awami from Tanzania, and Azoil now was hosted as part of Journalists for Human Rights Mobilizing Media in the Fight Against COVID-19 or MMFC project. Africa, Health Journalists Network of Uganda, the Media Owners Association of Tanzania, and Sound Africa. Link to this webinar. We will be sharing a link to this webinar on our Facebook page, so please look out for it. And those to you. Until next time, stay safe and sound.
Goodbye.